And today I'm gonna cover a very important topic for preventative medicine, lifestyle medicine, and in general well-being, and it's gratitude. Gratitude is very important not only to prevent, but for daily life. And today's lesson, we're gonna cover psychological aspect of gratitude, philosophy, why it's important, and medical point of view, why a healthcare professional motivating patients to use gratitude and learn and practice gratitude in daily basis. You're going to explore the culture differences and history about the gratitude. Our ancestors used gratitude daily and passing this knowledge and practice from generation to generations. However, they start to slowly losing such practice, and we're losing a lot of tradition that they need to find a way how we can restore them. Also, we find and we'll explain cognitive mechanism, why it's important and what happens in our mind, why they are blind. So I will mention my previous lessons about blindness. Also, is a very important part of forgiveness and other psychological aspects to practice gratitude. We'll analyze neuroscientific evidence, what is behind and what part of neurotransmitters involved, and how quickly you will see improvement of practicing gratitude in daily basis. And also different tools, where to start from is very complex, and with daily practice, I'm sure all of us will be able to feel a difference with quite short periods of time. So why gratitude matters? Gratitude is a core determination of well-being. It's prediction of low risk for depression, anxiety, cardiovascular disease, and improve immune system. People who are grateful and who practice gratitude get ill much less often, so they have a much better immune system, they have better relationships, and in general much healthier and happier. And also they live up to 10 years longer. In preventative medicine or lifestyle medicine, gratitude is behavioral vaccine. So as it's reducing stress and making your decision based on your values. Lifestyle medicine also support being grateful is improving your diet, exercise, and mindfulness. Then, and the key factor for stress management, I think it would be very hard to reduce the stress if you wouldn't be grateful daily what's around you, and you'll notice little things that actually life is made from. Gratitude shifts focus from the assets, what you already have, by improving and motivation for health and behavior changes. As we know, on the time of huge struggle in terms of emotional and mental health, and also physical, they're under severe pandemic of obesity and mental health crisis. Without gratitude, it will be very hard to address or support very important changes. Where all healthcare professionals now getting united, and they're trying to develop different structures and different strategies how to motivate people. And gratitude is one of the key points of success for long-term success. Gratitude shifts focus, and as research says, it shows that lowering up to 23% of cortisol is a stress hormone, improving sleep and reducing inflammation. Sleep and inflammation biomarkers, they are leading to cancer, dementia, and other inflammatory and chronic diseases like diabetes and even obesity. Let's talk a little bit about the history. And in Greek philosophy, the gratitude was a marvel of virtue, and Aristotle linked gratitude to ethical flourishing. In different words, it will be very hard to flourish if you're not grateful for your existence, not grateful to your parents, to your friends, to life in general, and to everything what you have. In Roman times, they evaluated gratitude as rational acceptance of as life gift and linked to cosmic harmony. So we need to live with the harmony and be grateful for that. In Eastern tradition, as Buddhist mindfulness of blessing, Taoist harmony with natural cycles, in Hindu prasada, in Hebrew toda, and in Christianity, majority of that literally is thanksgiving, and Islamic shukr. So gratitude found in all cultures, in all religions, and is that important to practice. In ancient civilizations, in the harvesting was the time of Thanksgiving, and we are in the season now of harvesting and the gratefulness nature is given to us for survival. In natural resources for gratefulness was framing gratitude for survival. Yeah, everything what autumn given us, so many fruits, vegetables to survive the upcoming winters, helping us to be grateful what we have done and what nature is giving us. In ancient medicine, Hippocratic texts, Hippocratic times, they in fact was trying to get to the balance, and gratefulness was to factor the balance. So you're grateful what you have, and actually you don't want more because you're already grateful what you have. And being more grateful and showing your gratitude to nature and surroundings. But nowadays we become blind. First of all, a lot of us and a lot of cultures, mainly Western world, we forgot about religious. We're stepping back from culture, and a lot of families and majority of Western countries, they're stepping back from traditions. Our ancestors or relatives, a few generations ago, were practicing being grateful and practicing gratitude in the church or in different events, religious events, religious traditions, and they become blind. I have special lesson about blindness, and this is biggest trouble nowadays, is pandemic of blindness. They're getting very unintentional blind, so we fail to see good, we fail to see positive, and the focusing our attention somewhere else, and it's quite shallow. It's very short focus. As you know, social media creating these tendencies, a very colorful, imaginary world, and actually taking us away from being grateful what we have around. And we become more hedonic adaptive. That means that humans, we normalize blessings, we normalize we're living such a better lives comparison to our relatives 100 to even 100 years ago. If you know the history, that life wasn't our life, equality, the people working for food, it was poverty. They are living in general worldwide so much better. However, they're not thankful for the science, we're not thankful for resources we have, and as a result become blind and they adapt to the modern world, and we see less happiness about it. We become gratitude blind. We don't see the things and don't showing gratitude, for example, for the same social media, for the same internet or artificial intelligence. They enter another world, but majority of us actually blaming rather to showing our gratitude. They don't know how to use it and they don't know the limit. It's very, very hard for us to live in a balance. As a result, we live on psychological biases, and negativity makes threats more than silent of the gift. We don't notice that. We don't notice the gift of the science, the gift of the animal, of the planet, of the nature. They actually more destroy and they want more. And the culture now getting more to consume more rather to be grateful for what you have. So unintentional blindness, again, blindness, what we all get born, have special lecture for this, so please go on my YouTube channel and see lecture. Then I talk more about different blindness. And inattentional blindness and unconscious blindness. So it's a physiological phenomenon we all have, all of us, all humans. It's a failure to perceive positive stimuli because attention is consumed elsewhere. And in the modern world, our attention mainly shifts to getting money, because when you have money, you can afford yourself in food and well-being and shelter. And nature actually giving us more, I would say, sun. If you don't have a sun, we're not grateful for a wind or a rainy day. We want sun. So we don't notice the beauty of the nature anymore, and we value only money, and it's a big issue and a big problem. So we need to learn how again to find these positive stimulus in daily life, in daily habits. But patients focus on symptoms. So we notice diseases, we notice symptoms, how bad they are, have been here, have been there, something happened. They're moaning about it. We're seeking for the doctor and healthcare professional attention. And we're not really focusing on improvement in the long term, one quick fix. So give me the tablet, do something about it because I'm suffering. This is your job. And here is the wrong approach. It's a ticket to nowhere. We won't be able to fix modern anxiety and modern obesity pandemic only with one syringe or only with one tablet. It's not going to happen. We need to introduce different treatment methods. We need to introduce long-term, long journey of improvement, and gratitude is one of them. Be grateful that you have access to medicine. Be grateful you have access to free lectures. Be grateful that you're breathing and your condition getting better. Little steps, please notice them. And this is something that we need to learn. Again, evidence of that is an invisible gorilla study, is experiment that illustrate how much we miss when we fixate our attention on something else. And unfortunately, our attention nowadays focus on earning money and financial well-being, rather health. And they need to balance. They need to get a little bit wider in terms of our priorities. Hedonic adaptations, again, are coming back. I want to talk a little bit more about it. Why hedonic? Because it's a human tendency to adapt very quickly, very adaptive. And our brain as well, very plastic. And we forget where they come from. We forget how much we learned. We forget what type of journey we've gone through, and is leading to gratitude erosion. If you're coming from a poor family, and just even if you're now age of 40 or 50, the life 50 years ago was much poorer comparison to now. But we forgot. We forgot how many toys we got. We forgot what environment we lived in, and we're not getting grateful what we have right now. And it's very sad because we get adopted, and our children even more living in much more, I would say, richer world. They even don't know what's mean poverty. A lot of children don't know what's mean poverty. Again, the poverty I'm talking about, the poverty being 100 years ago. Not we understand in modern poverty when you have an iPhone and you have so much more comparison to our grandparents 100 years ago. So, and of course, with this type of attitude, fostering chronic undervaluing what you have, and much, much harder to reach happiness and reach these being grateful words towards what we have. Willful blindness is a conscious choice. So it's unlike inattentional blindness, this deliberate avoidance of acknowledging something positive. Willful blindness is, I would say, one of the number one blindnesses in marriages and in families. Then we're taking it as granted. So if your loved one doing something for you, for blanket, for taking it, you have to do it. This is your responsibility. This is your job. And as a result, it's creating this mistrust and, if you like, social conditioning, valuing self-criticism over appreciation. So we notice what we do. We notice we value ourselves as a epoch of narcissism, of egoism, selfishness. We value what I'm done, but we don't see what other people do for us. Their attention the appreciation, the time, gratitude for being together, enjoyment time together. So, and majority of us, sadly, in the family and relationships, blaming each other, and not only in the families, but families, the most important thing, the most, I would say, priceless thing that we have. And amount of divorces and amount of broken families actually linked to willful blindness and lack of gratitude to each other. We don't see them, and they need to learn how to notice. And today we're going to discuss how to do this step by step. Gratitude is a corrective vision. When you start to practice gratitude on a daily basis, you practice to notice positive things. And it's antidote to both unconscious blindness and willful, and your refusal to see positive things, your decline to see progress. Because life and big changes in your life, if you want to achieve them, you have to be patient and grateful for tiny little progress, and the people who support you during your journeys, your loved ones, healthcare professionals, the same social media and artificial intelligence. For you know that nowadays, artificial intelligence, people behind it, losing billions of money every single year to provide us information and services they're so not grateful for. So please think about it. 6 billions that somebody given to us for granted, for free of charge, for us become better version of ourselves. We don't need to pay anymore so much money for education. We can learn so many things. So did we notice that? Did we say thank you for the time we're living in, not only blaming of social media or artificial intelligence for reduction of our jobs? So we need to change a little bit of a mindset and be grateful for progress humanity done, but as well learn how to balance it and be grateful for the nature and for environment where we are in this moment. By practicing deliberately noticing, you can retrain perception toward hidden positives. Yeah, we just need to open your eyes and need to practice that. Each act of gratitude recalibrates your attentional biases, and attention is very limited. So we're limited. If you're going to focus on something negative, you're going to miss positive. If you're going to paying your attention only on the bad things, you will miss the good. And if you shift your attention to notice good, by the time you will start to notice more positive than negative. And you will surround yourself with the same people. And this comes like mirror. Yeah, mirror neurons we all have. If you say kind words, very, very hard to say you something negative back. And this gratitude goes around, fires around, and actually coming back to you with more positivity. In preventive medicine is key because when you want to introduce lifestyle medicine changes to your patient, to your client, it's very important. Teach them to be grateful. Explain this long process because gratitude blindness during a health crisis is very important. You need to see that improvement is not far. Yes, you have to work for it. Yes, you have a practice, but with daily practices, you can improve. 75% of diabetes might be reversed. Obesity might be treated, and obesity is a chronic disease. It's a chronic disease as diabetes, and it takes much longer, even time, than treat diabetes. So you need to be patient and take it seriously, understand the journey, and be grateful every single process for every healthcare professional who coming along to support you during your journey, to your family, to your friends. Teach gratitude as well for your loved ones as teaching attention for the positive, creating the world, and your mindset much, much more flexible. As sadly, people start to practice gratitude only during severe health issues like cancer or chronic diseases or chronic pains or some negative event happens. So we want this to prevent, because we can prevent negative things happens or a lot of chronic diseases to be prevented or reversed by simple daily steps. So gratitude as mindful seeing overlaps with mindfulness, and empathize, rational awareness. Also is overlap with forgiveness, because it's very hard to be grateful if you're so angry and you didn't learn how to forgive others, how to forgive yourself. This anger will sit inside. So all these very important practices involved, we need to practice them as a training, attentional spotlight toward positive changes. And gratitude is the eye-opening process as cognitive reframing. So you reframe your thinking. A lot of different therapies like acceptance, ACT, acceptance commitment therapy, or CBT, cognitive behavior therapy, are linked, and the very important part of them will be gratitude. So you can practice with your therapist, with your practitioner, or even daily by yourself. So knowledge and experiencing gratitude is not naive positivity. It's not because you're blind. It's opposite, because you open your eyes to something positive. It requires cognitive maturity to see context and meaning and relational dynamics. Please don't teach your children to be grateful. I know that some parents trying to teach the children to be grateful. Grateful you have mom and dad. Be grateful what you have that. I think for children, they're immature. They're not mature enough to understand what's going on and what exactly your words mean to them. And then actually you might fire more fear and create more trauma to your children rather teaching. So let your children stay a little bit aware until they're a little bit older, and opposite way how you can teach them to be grateful. Be grateful yourself towards your children, and reflect it and show your behavior. Be thankful for your children. So I'm so thankful that you're such an amazing daughter and some amazing son. I'm so lucky, mom. I'm grateful that you are in my life and you are my son. And with gratefulness, noticing what your children do, you teach them rewards, and in future they will be the similar gratefulness towards you as a parent. A physician role in this, or doctors, healthcare professionals, all of us, so we're stepping into psychology, into gratitude as well, is we want to our clients to recognize positivity around them, and is a lot linked to chronic diseases and medical condition, because when we are entering lifestyle medicine, we're trying to find where is the root of the issue, where is the problem, and we want to prevent development of chronic disease. And of course, a lot of people getting shocked, they have anxiety or in denial, or a little bit blind that we need to do or exactly what we need to do. So we need to direct in the right direction to find the roots where it is, and teach them positivity, that don't worry, yes, it's happening right now, but the right steps with daily practice, you overgo this and you reverse your illness. You'll be out of medications. But before that, I'm prescribing you to practice gratitude, to practice meditation, to exercise, improve your sleep routine. And actually, gratitude is a perfect opportunity to create your beautiful sleep routine and good night routine as a daily practice before you go to bed, and actually your sleep gets improved. So gratitude is a value-driven emotion. Yeah. So to be grateful, you need, first of all, identify your values and you live by your moral. And of course, if you don't know yet your 3 core values, I recommend you to find my lecture about values, and you can go with me with a test. And I describe in values step by step. As gratitude is not just feeling, but recognition of alignment with what you value the most. You won't be able to be grateful if you're surrounded by terrible things that cause you anxiety and cause you stress. Yeah, so we need to, first of all, identify your values, shape what we notice, be around. Yeah, but sadly, a lot of people even can't name the 3 core values. So if you want to practice gratitude, please start step by step. Find your core values. Forgive the people you have anger for, and name your emotions. What do you feel? Yeah, and when you have this vocabulary and you've done your first steps, you also be much easier to be more grateful. So you have to go in the right directions. You need to do right steps. And healthcare professionals, psychologists, psychotherapists, different field in healthcare, we are here for you to support you with right directions and the right steps. Study shows that gratitude activates prefrontal cortex and involved in moral reasoning and value-based decision making. So, but as I said, everything is linked. You need to identify, name it, and then practice it. Dopamine and oxytocin. Oxytocin is a bonding mother of the child, of your parents and loved ones, and dopamine is motivation. It gets to straighten and reinforce the value-driven social bonds. When you practice it, you will see that your connection with your loved ones, your relationship, your motivation get increased. So you'll be more energized toward changes. And practicing gratitude strengthens circuits that guide behavior according to your personal values. So what is neurochemical effect? I love neuroscience, and I think we need to understand that all the changes what we do and our mind and our neurons in our brain are crucial for the changes. And of course, here we're talking about dopamine. Reinforce gratitude, like forcing to notice things. To start with, you might feel hard to do it, but in practice, it becomes a pleasurable process because serotonin start to produce more. You improve your gut, improved your gut-brain axis, so your mood getting better, and you enhancing your bonding, oxytocin, your cortisol goes down. You have like a stress buffering effect. As a result, I can say that a lot of neurotransmitters involved, including GABA, and gratitude is multi-neurotransmitter intervention and is natural pharmacology within just kind words and noticing good things happening around you. So in terms of brain rewiring, it does take time to rewire your brain. In terms of timing, neurons fires together and wires together, and it's making big changes, measurable changes within our brain, and main one, increasing gray matter's density and how quickly you see result. Okay, primary result, if you start to practice gratitude, notice positive things in life. You see already within 2-3 weeks, you usually notice that your mood getting more positive. You might notice a little bit happier, and you might improve your sleep, because we recommend practice gratitude before you go to bed, because your day go to the end and you want to talk about, meditate, and like a mantra, say mantra about good things that happened to you today. But measurable brain changes happen within 3 months' time, around 12 weeks. And these changes might be even catched on EEG and fMRI scans. Of course, we're not going that far. Don't ask your GP or doctor or healthcare professional, I want to see improvement in my brain. Don't think that is we want to do, but we have a lot of publications and a lot of evidences before and after practicing gratitude. And we know that within 3 months, in quite reasonable time, you will notice significant improvement. Sustainable practice, in long run, in long term, you build up your resilience and respond to the stress. Prescribing gratitude as 8 weeks, it's another very good step to antidepressants, another pill with exercise, nutrition, and sleep rituals. If you said notice then doctors start prescribing more and more practical skills. Don't be surprised, because medicine in general shifting to preventative medicine, and we won't be prescribing medication rather prescribing them, because benefits, it's huge. Just we step in new era in terms of healthcare. So in terms of mental health, we know again anxiety, depression, and mental instability, changes in the mood, depressive symptoms is playing a huge role. Once you notice good things happening, meta-analysis confirms that that effect similar, comparable to CBT, cognitive behavior therapy treatment. So, and you don't need even therapists. You just start to notice good things around you, and you just record them. You can make a video what good facts witnessing. You can write down on different apps. You can have a journaling, whatever is easier for you. You can just talk over phone, record your speech. You can record your own videos every day to see even how your mood change, because your facial appearance will change as well, because the way how your person showing very quickly on your face and your wrinkles, and the way how you smile. Gratitude predicts lower suicidal rates as well, increased resilience, and of course improving your emotional response. So in terms of evidence-based, we have a lot of evidences. If somebody wants to read the papers, please visit and ask artificial intelligence to provide you a list of a link. Make sure, because artificial intelligence sometimes very cheeky. Sometimes when you're writing down the paper for you, depends what you want to hear, to boost your trust. So be careful. But of course, just ask when you want to read professional, professional source in professional magazines and professional reliable sources. But improving sleeps quality, is reduced systolic blood pressure, is improving heart rate and parasympathetic tone, and enhance healthy lifestyle as well. So you'll be more positive towards exercise, towards diet, and or any treatment plan when you're going through with your healthcare professional. And it's very important, because be grateful what you have, actually speed up the process and make it much, much easier. In terms of gratitude and longevity, they have a lot of different studies confirming that gratitude predicts lower mortality within the next 10 years. And as is lowering stress, have a lot of biomarker improvement in terms of general health, and longevity biomarker and positive effect on psychology. In medicine, I want to highlight, because healthcare professionals, we're new to such approach, and recommend you to write down, instead of giving you, prescribing you medication or money, to give you advice to just write 3 things, what good happens to you, or what did you see the good today happen and write it to you, apart negative. So that will strengthen social bonds, reduce conflicts, and increase empathy towards people you daily interact. In healthcare, of course, you will facilitate burnout of healthcare professionals if you start to practice gratitude, and you'll be more positive towards healthcare professionals. It might be pharmacists in your pharmacy, it might be nurse, it might be your GP, doctor, or other healthcare professionals involved. Is a big umbrella of healthcare professionals. So please take care of them. Yeah, because people who work there are going through very long studies, long hours, and a lot of health professionals now experience a lot of burnout, because there is no cure for pandemic of mental health crisis and obesity crisis. We need to do something about it in the long run. So it's not only give you, I feel better because placebo effect, you give me a pill, prescribe me the pill, or some injection. People love injections. I'm surprised. If you tell them to take care of themselves, to find out what to find, no, they prefer injections, and they're ready to pay more money. But it's not the right way. You wouldn't go far away with that type of approach. So how we can practice it? So we have a structured and unstructured gratitude. Structured if you are more left hemisphere. So you're very practical mathematician working in some structured business, and you're very logical and very organized. In this case, make your diary as every single day you do the same, but write 3 things daily what you're grateful for, the good things happen to you, what you learned, or and the challenges that you faced on them as motivational for you to improve. But challenges, not negative side, positive. And structural, it's just good things. Just be creative. Write down how you feel, how the good colors or painting effect on you today, or music, or you heard something interesting for you that inspires you and make you smile. Actually, it doesn't matter what will be more suitable for you, which form it is. You might be singing, you might prefer sing about it, you might smile, whatever more suitable for you, you feel more confident and the right way. As well, Google. Ask artificial intelligence for your help, maybe give you a little bit more ideas, link to your values, link to your daily choices, or some sort of, if it's hard for you, what will be the right approach? Of course, approach healthcare professional, psychologist, counselor, or for the help, even your friend. Speak with someone if you have someone to talk to. And just practicing, trying to start maybe every few days, if you like, because maybe every single day might be too hard for you. Maybe start once a week, then increasing twice a week. And then when you're practicing, you will see you don't need any more journaling, because you will be already grateful what you have and you enjoy surroundings, you enjoy what is around you. Gratitude letters and visits as well is great. So what's the gratitude letters? Is the letter of thank you. You know, these thank you cards we can buy in different card shop. That is a gratitude. So you can say thank you to your, again, teacher or your mentor or teachers at school. Somebody supports you. Thank you to your friend. And I don't know, send them thank you flowers, a thank you letter, or message them, record video. Thank you visits as well is a surprise visit to somebody to say thank you. I'm not motivated by too many attention or by the presence. It's not about the presence. It's about the attention to see that you value them. Role in trauma and recovery is reconnect individuals to source of and support. And in clinical applications, patient writing letters to caregivers or loved ones as well for the love and support, because it's crucial for them. Yeah, when we see how loved they are and how grateful they are for the people surround them, is creating this very important bond and speed up as well recovery. So guided reflection practices is meditation scripts and integrated gratitude. So you might create these just mindfulness and meditation with the music. You might create your own ritual, or maybe with friends, or I don't know, some anything was suitable for you based on your culture, religion, and beliefs. Bedtime gratitude reflection to improve your sleep and improve your dreams, because you're rewiring your brain to the nighttime. And breathing work. So remember, it's a 4-7-8, the most common breathing work in case of stress, anxiety, then you have panic attack or any depressive thoughts. Breathe and think about positive emotion, because it will help you to relax and step back from your anxiety. And group guided reflections and therapy or medical training, as I said, might be your friends or even artificial intelligence. We have so many different apps you can talk to, even online. ChatGPT offer such services, or other platforms. Then you can speak for a few minutes. If you feel not confident or shy, to open everything what you truly think about. So digital mobile apps, you can set up alarms for yourself, but the importance, alarms always give you boom, 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 boom. It's at 8 o'clock. It's your meditation time. This is your gratitude time. What happens? Yeah. Social sharing of gratitude is reinformed practice via community, so you can publish their gratitude via social media. You can send it online on your WhatsApp story, or online depending on the platform, or just send a thank you message about how grateful you are, and pair your gratitude with your, as I said, CBT digital tools is different mindfulness, meditation, and cognitive behavior, or acceptance and commitment therapy. So as a final, gratitude is awareness, first of all, and neuroscience and practice. We have to practice. As like anything else, is a daily rewiring your mindset to something positive and notice more good things. And it's very transformative tool. Call to actions for all of us, including healthcare professionals, that we have to we have to notice the good things that other patients do, the effort. So it's not only for practitioners, and not only for patients or you as individual, it's as well for the people who is looking after you, because giving your pill is not a solution. It's no solution. It's not gonna go nowhere. Talk about it. If you fear or you have a troubles to progress and you understand the importance, or even talking about it is helpful. If you don't know where to start, watch gratitude videos, visit YouTube, see maybe another explanation, another inspiration or success stories, how people use that and how that gratitude changed their life. Invite audience to identify one thing they are grateful, and share your gratefulness with others. Okay, I think it's very important. Gratefulness is a very hard topic. Not hard, I think it's a very joyful topic. But you need to grow up and mature to be grateful. It's mainly about maturity. So find your values, shape your moral, identify and name your emotion, find your anger and people you have to forgive. Once you've done these steps, you're stepping into gratitude. You might start with gratitude to start with, but as a tool, but don't forget about other aspects, because they're all important. There is no one. The balance here is the key. So don't forget that making changes is a very long and very hard process. Ask for help, follow your dreams, and remember that step by step you'll get to your destination.